Hi, my name is Campher, student ID 100017327, and this is Unit Standard 7337 Care for Dogs Video Assessments. Okay, so what we're going to do is we're going to remove a dog from a cage, kennel in this instance. What you want to do is obviously first, when you're approaching the cage or the kennel, try and just assess the demeanor of the dog. Obviously, if he's quite aggressive or doesn't seem to be at ease, you would maybe get additional assistance or help. In this case, we're using a Golden Lab Retriever Cross. Her name is Peggy. She's reasonably placid and calm. So when we're going to remove her from the cage, first of all, opening the cage, we only want to open it big enough for us to get our hands in and get the lead on Peggy. So we will open the cage and try and just hold it like that so she can't bolt past. Yeah, Peggy. We'll get her close enough, get the lead hooked on before she can go anywhere. And we've got her on a tight rope, and she's safely removed from the cage. And then we are just going to lead her away, holding the lead as close as possible. The dog, you want to hold the leash as close as possible to the dog, which gives you more control over the animal, and then we lead her away. We're going to lift her up on the examination table, and we've just weighed her. She's about 26.5 kg, so usually dogs over 15 kgs we would get the help of an assistant to lift them. So I've got Jane here that's going to give me a hand to lift her onto the table. So one person takes the front quarters, the other one behind, and we'll go 1, 2, 3, lift. And get her safely onto the examination table. Right, so restraining the dog, we'll just gently take her with one arm under the front quarters here. If it's a male, we'll just be cautious not to put a hand over the penis or the genitalial area at the back. They don't like that, and generally try not to cover the ears or the eyes of the dog, and just hold her like that for general examination. If it's the other way around, you just repeat the whole holding process just for the other way, and hold her for like that just for general examination. Right, so tableting a dog, you don't want to take your time doing it, so we want to try and get it over as soon as possible. They don't like it, so what we do is we grab just behind the canines on the upper jaw, and touching the lower jaw, they generally open their mouths. You want to place the tablet as far back in the throat as you can, and gently close the mouth, and a bit of a rub on the throat like that, and it should be all gone. And that's how we administer. Right, so we're going to take the temperature of the dog, and before you do that, you want to make sure that you've got all your things ready, because obviously the dog doesn't understand that she's going to have to be patient and sit around waiting. So we've got the thermometer, and we've got some lubrication, we've got a swab, and we've got some preferably alcohol wipes, which we're just going to disinfect and clean the thermometer with. And then just moderately apply some lubrication to the end of that, obviously to make it as less uncomfortable as possible. Now with the digital thermometer, it's quite easier than the mercury ones, so we just switch this on and wait until it indicates a neutral reading, which is an L indicated by degrees. And then we can approach the dog, and with the help of a second person restraining the animal, we'll just gently shift the tail to the side, and when that's ready to go, we'll insert it into the rectum, gently tilting it upwards, just so it doesn't sit in a piece of feces inside, but actually touching the rectum wall, and keeping it in place for at least up to around about 45 to 60 seconds. In this case, the digital thermometer will beep when the reading is constant and taken. So it's still counting, and I will show you the reading after it locked on. Ideally, we want a reading between 38 to 39 degrees Celsius. It's going 37.7. It's still counting. It can take, like I say, up to 45-60 seconds. It's 37.9.
I'm thinking, is that even practical with the little one? There is one over there, and it is really disgusting. We could buy it. It just got young and would like it.
It would be quite fun to see what he does. We can have like a really leery row.
What was that with the one with the boozy pink on?
We're just going on to a minute now, and exactly there we go. And we've got a reading of exactly 38 degrees, which is ideal. And just let the tail go, give her a bit of a pat, don't ever forget to stroke, and that's how we take the temperature. So after we've taken the temperature, immediately jot it down if you're going to take any other vital signs so you don't get any calculations and numbers mixed up. After that, you immediately want to clean your thermometer as well, using again a disinfectant swab, making sure that it's thoroughly cleaned and disinfected, especially before using it on any other animals. And that's how we take the temperature of an animal and clean the thermometer afterwards.
Good.
Okay, so bathing the dog, first of all we're going to wet the whole dog, dampen the whole dog down from front to back, and being mindful of the eyes and ears, we're going to just use our hands like that to try and keep most of the water out of the face.
Good boy.
So we want to stay away from the eyes and ears. Just go over the whole dog. Make sure all the hair is wet. In this case we have a restraint at the back here, which makes it a lot easier. If we don't have that, we can always just get the help of a second person to help us hold the dog from the neck area at the back here, and just apply it moderately, gently working into the coat. Once we've got most of the back and the hind quarters soaked up, we can actually start working on the side. Just use your hand. It's easier having a squirty bottle like this. It just makes it easier to apply it, and you just go through the whole dog applying it. This is a female piggy. If it was a male, will also obviously just be a little bit more gentle in the genitalia area. Rinse her off. Again, just obviously being mindful of the ears and the eyes. You don't want to be squirting water directly over or into the eyes. So we'll just use our hand to shield the eyes and ears from most of the water. Afterwards we'll just use a damp cloth to wipe the facial area and give it a bit of a clean up as well. And just wiping away from the eyes will clean a bit of the head and around the eyes and the muzzle. Good girl. And shampoo rinsed off.